Bismillahir Rahmanir Rahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Nahmaduhu wa nusalli ala rasulihil kareem wa ala alihi wa ashabihi ajmain. We are talking about heart disease. I don't need to tell you why that is serious. I think all of you already know. But just because sometimes it's the case that we know something, but we don't actually have a clear idea what to do about it, or sometimes we feel as if it's unavoidable as a part of perhaps aging, as a part of living in the place where we live in. So this therefore becomes a fulfilling prophecy for a lot of people. And today, inshallah, I want all of you to go away with a couple of messages. One of them is that heart disease is completely avoidable. Number two is that the heart disease is not ever something that we should think has been a scourge of the modern world and we are helpless against it. All of these messages are coming from, I believe, people who have perhaps not understood that this is something we bring upon ourselves. It's very much a self-inflicted illness. What's the extent of the illness? Why is this a concern? Secondly, some very well-known factors that are an issue in heart disease. And thirdly, some ways of giving answers, because I think that's really what all of you want to know. So let's go right away to the extent of the problem. What's the extent of the problem? Well, the extent of the problem is by numbers. You can see, and these are American numbers, but you can divide these numbers by 10 and you will find that the statistics are very similar in Canada. Unfortunately, the statistics in Canada are very similar. So which means the percentages won't change. Here you have 18 point something million. By the way, these are 3-year-old numbers. So they're not brand new. Sadly, whatever happens, we actually find increase, not a decrease. So people aren't getting healthier. The reality is people are more unhealthy than they used to be. And we'll go over the causes. So the numbers, 20% of heart attacks are silent. We will not know that you had a heart attack. About 18 point something million Americans age 20 and older. Please look at that figure very carefully, age 20 and older. So a 19-year-old can have heart disease. The causes are slightly different from what they would be for a person who's obviously in their older age group, but they still will have heart disease as a possibility. It is the number one leading cause of death for men and women. All the women sisters who are attending, please note this is not just a man's disease. And the number of men, not men, Americans who die from heart disease each year, as you can see, it's not a small number. 640. I mean, that's a big number. We're so worried about COVID. We're worried about so many other things, but we really have to think carefully. What is it that we actually have to deal with? So we're not dealing with small numbers. We're dealing with big numbers. So we have 80% preventable cases of heart disease and stroke. I want you all to please carefully make that note that we are dealing with a preventable illness. We're not dealing with something that is inevitable as a part of aging. Please make that mental note as we go. So let's go next and see what it is. Why is this issue the way it is? Like I said, what does heart disease, what does it actually do? Well, what heart disease does is, as you can see in the little cartoon, that there is deposition of cholesterol, which is basically what is fatty, normal fatty tissue present. It's not tissue, but it's a part of the blood components. Cholesterol is present in bound form and unbound form. To make it easy, it will be flowing in the blood, but it will also be present in stored form. And in stored form, it will usually be hormones. It'll be things that help, if you like, digestion, etc., taking place. So it's not necessarily justifiably given the bad rap that sometimes it is given. It is actually necessary for the body. It forms cell walls, which means it is necessary for every body cell to have cholesterol present, because that's what gives it, if you like, strength. So cholesterol is not a bad thing. But what actually happens is deposition of cholesterol. We're not going to go into the great detail here because obviously our time is a bit limited. But what it does is it reduces blood flow because of the narrowing, the physical narrowing of the space in the artery or the vessel that you can see in this photograph. And so what that results is in an imbalance between demand and supply, which is the main issue that we deal with. So let's go and look at what people perhaps don't realize. Cardiac bypass, and I'm going to give you some gross, some graphic appearances, because I think you do need to see how serious a problem this is. Cardiac bypass, which for a lot of people seems to be almost like a, I wouldn't call it a simple procedure, but it does not seem to make people think that we are dealing with a life-threatening procedure. This is a really serious procedure. The chest is cut open. The biggest, I shouldn't say the biggest, but the strong bone in the middle of the chest, called the sternum, is sliced by a saw. And this is really what you look at when you're doing cardiac surgery. What you're looking at, in case you haven't figured it out, is a person's chest open with bypass proceeding. The heart has been stopped, and this is what's happening. What can happen as a result? Well, you can see on the left of the picture the complications that can result from actual bypass. I'm not talking about the heart disease. I'm talking about the complications that can result from heart surgery. And this includes things such as 30% of people with neurological complications. What does neurological complications means? It means that people can be left with a permanent, if you like, deficit of thinking. Cognitive thinking, which means they may not think clearly, they may have memory issues, they may have other problems related to the brain. The idea is not to go into these details, but to give you all some idea how serious this issue is. When surgery is performed, that's also serious. So the seriousness of the illness, number one, and then now what I want to do in the next 2 or 3 slides is to give you an idea of how serious the treatment is. So treatment is not simple, because I think people have perhaps misunderstood that treatment of heart disease is some simple issue. And this is particularly being the case because indeed a lot of these procedures have become safer because of the equipment's improvement. Without question, technique has improved. There are other things that have entered into the equation, like angioplasty, etc. But look at the last figure. 50% people, these new blood vessels that have been placed. So what bypass does is actually places blood vessels between the abnormal and the normal part. So the portion that I showed you, where a portion of the artery or the blood supplying vessel, which is narrowed because of cholesterol deposit, what the surgeon does is he or she puts, if you like, a bypass between the blocked and the unblocked. That's really what bypass involves. But as I said, the complications of the procedure itself is not small. So now what is angioplasty, which is the other thing which a lot of the time is taken very lightly. I've met a number of brothers and sisters who seem to think angioplasty is something similar. It's not simple. It may be done simply. It may be very common. It may be a day case procedure, but it's by no means simple. It has some serious problems associated with it. And I've mentioned just 2 of them. It's an invention. It's been around for more than 40 years. So it's become very much a part of people's psyche. But its complications mean that sometimes this inflated balloon, which is what you're seeing, and I'm sorry, this is not the best photograph in the world, but it gives you some idea that there is a problem. If there is a problem with this stent that is placed in the narrow blood vessels, this alone can cause the need for an urgent surgical procedure. Why is that? Well, because if the blood vessel that is being, if you like, distended or dilated with the help of a stent, and a stent is very much like, you can imagine, a plastic pipe, which is basically, if you like, strengthened or further, if you like, given some additional capacity to allow dilatation. This strengthening with metallic wire, Teflon, something very minor, never going to result in anything serious. But this metal can also cause, this fracture of the metal. There can be technique insertion problems. And so this angioplasty, sometimes as it's being done, can actually lead to a reason for having an emergent surgical procedure, such as the bypass that we just talked about. About one third of these will block in about 4 to 6 months, which I think is also not small, should not be underestimated. Now, what are the fundamental causes of this bypass, this blockage, this cardiac disease to begin with? Brothers and sisters, please remember, for the purposes of this conversation, we're only discussing what is the most common kind of heart disease, which is the narrowing of the blood vessels, which cause the reduction of blood supply to the heart. This is all we're talking about. We're not talking about valve problems. We're not talking about people who are born with heart disease, such as deficiency or some partition between the blood, between the left and the heart, right, not forming as a result of birth errors, congenital errors, etc. We're not talking about that. We're talking about the broad mainstream heart disease that results from narrowing of the blood vessels to the heart. So for the causes of those, this is the main 5 causes. And I put that from on highlighted form so you can all see that cholesterol and saturated fat are a part of this illness. Unmanaged blood pressure, which means high blood pressure that is not identified or not treated, also is a cause. Without question, cigarette smoking, nicotine is another big factor. And last, which I want all of you also to please note, is unmanaged stress. This is not a small part of heart illness. It's actually a very big part of it. And sometimes people don't realize how much this stress component, if it is not dealt with, and there are ways of dealing with it, if it's not dealt with, it can actually also result in heart disease itself. Now let's look at what are the things that doctors can prescribe for cholesterol lowering, because you would have all, I'm sure, heard that there are cholesterol lowering drugs available. Because the first question I get asked is, well, what's wrong with just using these medications? Because, if my cholesterol is high, I don't have to do anything else except just take pills. And pills are very highly promoted. There's no question about it. But look at the risks of these drugs. And what I'm pointing out in this particular slide is what are relatively new monoclonal antibodies, which are called PKS K9 inhibitors. You don't have to remember that name, but look at the cost of these. The cost to the health system, not necessarily to the individual, is about $8,000 a year. This is what we're dealing with. And then you have very serious side effects, such as liver and kidney problems. And I'm not talking about small problems. I'm talking about somebody who runs into issues such as liver failure or kidney failure. So we're not dealing with something small either. The other part of this is the statins, the levostatin, the somvastatin, and others. I'm not going to go into the details of it, but the generic medication that cause lowering of cholesterol, and statins, by the way, have been around for 30 years, maybe not 30, but close to 25 years. So they are also known to cause problems both with liver, and also they can actually induce diabetes itself. The other thing is the relatively rare muscle breakdown condition called rhabdomyolysis. So this is another something that has to be thought of when people go on to cholesterol lowering drugs. And some of you who are on them, and I'm not saying that you are, if some of you are, please have a conversation with your family physician. Please do go over these things and don't take these as ipso facto, as these drugs are around and they've been obviously been used. So I'm not saying they're unsafe, but I'm saying before you go on to these medications, please consider the alternatives. And this is really a lot of this, what this webinar is really about, talking about the alternatives. So what about lifestyle changes? Well, lifestyle changes, of course, and this is what I wanted to mention right at the beginning. These are things that perhaps are not mentioned so much, right? And this is really what this webinar is all about. We want to talk about all the other things aside from surgery and medications. And here, needless to say, these 5 are probably not 5, but they are definitely 4 to 5 causes, which are probably likely that you will actually avoid most, if not reverse. So you actually have 2 options. And because the webinar is not perhaps going to allow me to talk about the reversal, but I will mention that what prevents also actually reverses. So obviously stopping smoking, exercise, whole plant foods diet, which means cutting down the amount of saturated fats, avoiding obesity. So these four by themselves will probably prevent most cases of not just heart attacks. Notice there's mention of heart attacks, there's mention of diabetes, there are mentions of strokes, which is body paralysis, and a third of cancer. So again, we're not, and at the end of the show, I will inshallah give you some references so you know where these figures are coming from. And the fifth one, which I mentioned here, is management of stress, which is of course not small. Now, you might now say, how come we don't know about these things? Well, think about it. Are we being paid as physicians to educate people? The short answer is no, we're not. And I'm not saying this with anything bad or any intent to demean what doctors do. They do an excellent job. My point here is, however, they have interests that they take care of. And those interests are very big time related to what is being promoted by the drug industry. And so therefore, science takes a backseat in front of the salary. The wealth of that's acquired, it takes a backseat, takes a front row seat versus the health that is being compromised. And of course, research is something that most of us would rather not pay that much attention to, especially because the reimbursement of seeing patients is so big. Again, this is the second question. Why don't we hear about stress management? Isn't something stress that is being, and by the way, so these figures are, these numbers and these concerns from stress are coming from basically not new. Dr. Dean Ornish, who's a cardiologist, he wrote a book called so this is really some of the things that's almost a pioneer in this heart illness. He wrote a book in 1977. It's called the Dr. Dean Ornish's program for reversing heart disease. I'll be very happy to give reference to anybody who's interested in this book. His groundbreaking research was backed up by something called the China study, which was done a bit later. In fact, it was done in the late 90s, where again, there was a huge contrast shown between people who were living in, if you like, urban US and people who were living in China. Not only that, but people in East Africa, Uganda, for example, the rates of heart illness in comparison to the urban Americans was unbelievable. It's almost 300 to 400 different % in the rate of heart disease. So we are not therefore dealing with something that is, as I say, inflicted by nature upon us or inflicted by God upon us. We are very much doing this by inflicting this upon ourselves. Cholesterol lowering agents, for those who are interested, these two things, garlic and alfalfa, are well known for lowering cholesterol. There is documentary studies, but we virtually never hear about them. And we can all ask this question, why is that? Why don't we hear about it? And look at the consequences of narrowing of blood vessels. This is just a very frightening slide where you have heart attacks, you have kidney disease, you have sexual dysfunction, you have heart failure, you have stroke, which is basically body paralysis, and you have loss of vision. So we're not dealing with something that is small. We have a serious problem. And nicotine, I think I mentioned briefly, but I'll mention it again. This is what nicotine does. So those of us who are smokers, those of us who have any kind of association, you will hear people who are very fit otherwise, but suddenly collapse during a game, for example, right? And you discover that they were, I mean, there's more than one reason, but cigarette smokers have a high incidence of blood vessel constriction and spasm. So what that means is the blood flow may be normal, but during exercise, certain enzymes and certain hormones, I should say, are released, and they have the acute ability to cause blood vessels, the narrow tubes of the arteries, etc., that are leading to the heart, to suddenly go into spasm and basically cut out blood supply. So a person can have a blood supply cut out, a failure of, as I say, function of the heart in response to the spasm that resulted from nicotine stimulation. So cigarette smokers should not underestimate the risks that they have of a heart attack, and sudden heart attack in particular, what's called the sudden cardiac death even, because of cigarette smoking. So what's high blood pressure problem? Well, high blood pressure uncontrolled high blood pressure does what you're seeing. This is not the only manifestation of high blood pressure. This could result from trauma also. But if this is a spontaneous pink eye, as you're seeing in the picture, this is something is a cause for concern. It suggests that small blood vessels are bursting, and perhaps if a person has not been checked, they should get themselves checked. This now is something I want all of us to look carefully on. If you have identified yourself with this kind of breakfast on a Sunday or a Saturday, and this is a regular thing, please be aware that even a single meal that is high in saturated fats and cholesterol can cause heart damage. And Dr. Dean Ornish, who I alluded to briefly, very much points this out in his book. And then later individuals who have written on this are Dr. Michael Greger, who's written a book called How Not to Die, and I've given a reference at the end of this talk of that also. But please look very carefully at the amount of saturated fat. And saturated fat, as I pointed out, mainly comes from meat products. It also comes from desi products, particularly the brothers and sisters who are of subcontinent background. It comes from oils. It comes from refined sugar. Refined sugar is not directly a saturated fat, but refined sugar adds to the body load of what would ultimately be saturated fats. And unrefined sugar will be in things such as chapati, particularly the Indian bread that people eat, particularly the white flour. It'll also be in all the products that contain sugar. Ice cream would be one, sweetened yogurt would be another, things like kheer, things like seba, all those things that have added sugar, whatever you call that product, baklava, and it depends, because you see there's a number of people on the seminar, webinar, so I don't know what the backgrounds are, but added white sugar, refined sugar is a problem, because this directly results in the body's increased load of sugar. And the average American, I'm not saying the average Canadian necessarily is the same, but since the numbers are generally similar, the amount of sugar needed by the average individual, for purposes of understanding and easy comparison, is 1 teaspoonful only. That's all we need. And on average, people are eating about 30 teaspoons a day. So that'll give you some idea what the discrepancy in amount of sugar that we're consuming is. And as Muslims, and I apologize if some people that are not Muslims are also attending, but the fact is, the Prophet Muhammad, peace be upon him, told us the importance of a healthy diet a long time ago. He said, sallallahu alaihi wasallam, may peace be upon him, that a worst vessel a person can fill is his or her stomach. A few morsels which can keep a person's back straight are sufficient. And if a person does need, he should fill 1/3 of the stomach. So our problem is not just the fact that we're eating unhealthy. Our problem, unfortunately, is that we're also eating more than what we should eat. So portion control is another completely different conversation, which, because of the relative paucity of time, I won't be able to discuss. But if we can remember that we have a transit time between the stomach and the brain of about 20 minutes. So what that means is, if we eat rapidly, we will not really know if our stomach is full till it's over full, because we're not allowing that time lag to take place between the stomach's ability to stretch and the brain's ability to find out. Because remember, the stomach doesn't know what we're filling it with. All it knows is it's the stretch receptors that help it understand that it's too full. This now is, I briefly alluded to nicotine. Nicotine, my brothers and sisters, remember, it has more than just the effect for you and me. This is really what has been put out on cigarettes for a number of years: heart disease, strokes, bladder cancer, affecting, what I call secondary smoke, children and other participants in the house, particularly smoking in the house. So nicotine is not something that's new. Now, I want to point out quickly something that I think we need to go into a little bit into understanding what things can we do. Exercise, and I alluded to right at the beginning, exercise does not need to be done in a gym. Exercise does not involve going outside the house necessarily, because we sometimes, when we haven't, not sometimes, if we've not been accustomed to doing some kind of physical activity, which means we are from home to car, to office, or to a train, and then walk only up to and then we're back in the same. So then most of us are not really giving any kind of challenge to our heart at all. So, but now I put a small, if you like, I've checked out some individual that may think vigorous exercise will undo what I'm doing by saying, well, I'm a smoker and I eat a saturated fat diet, but I also don't have good management of stress, but somehow I think vigorous exercise will undo all of this. I'm sorry, it will not do. So what I want all of us to remember is exercise will not undo a bad lifestyle. It won't do. So eating a diet that is high in saturated fat, and I'm saying this again and again because this is one of the biggest components of cholesterol being raised in the blood. Cholesterol high in the presence of a person who's obese, for example, a person who does not take part in physical activity, a person who has other backgrounds such as unmanaged blood pressure, and who has stress that is not managed well, this individual is most likely to have heart disease. And this individual, unfortunately, is also like to have more of chances of affected by this heart disease in the form of a heart attack. What is the role of stress? The role of stress primarily is increased hormones in the form of adrenaline and noradrenaline. So if you can all remember, I'm sure you've all had that feeling of a doom, the feeling of doom, as it were. And you hear bad news, or there's, suddenly a work, if you like, deadline that's come up, and I'm not prepared for it. Or there's an argument between me and a colleague, or me and my spouse, may Allah protect us all. But some kind of stressful situation, these are the things potentially that happen in that response. And so for those of us who have kind of what I call the short fuse, the type A personality, this really is a big risk in heart disease. Actually, it's one of the reasons why anger management and stress management are such an important part of heart disease management, not just reversing, but not just prevention, but also reversing also. So again, these are technical things. I don't expect you to remember them, but I want you to all make a mental note that this is really how certain heart death can result, which means when people don't have adequate management, and notice for, I think one of the participants was asking about genetics. Genetics is a component, but that's only because this has been something that the person was born with. So like, for example, an unmanaged or undiagnosed disease of the heart, which caused the heart to expand. And the heart expanded to the extent where it was no longer able to, if you like, transmit blood, because the heart's main function is to pump blood around the body. And if it's not able to do that, that's really what causes the manifestations of heart disease. The most obvious thing is chest pain, as one of the participants alluded to earlier on. But really, the other manifestation of it could be breathlessness. It could also be inability to do the normal activities. So people will find cold days are more difficult, right? When they are stressed out, they have more, if you like, a feeling of chest pressure sometimes. I mean, these are late signs, and I'm not obviously doing a big explanation of what heart disease symptoms are, but I'm simply taking more emphasis into saying these are the ways you can avoid leading into the issues of heart disease to begin with. This is Dr. Ornish, who I alluded to earlier on. He actually mentioned this years ago. This is not new. He said, think about it, heart disease and diabetes account for more deaths in the US and worldwide than everything else combined. I mean, that's a serious statement. They are completely preventable by making comprehensive lifestyle changes without drugs or surgery. I think if you remember nothing else from this seminar, that would be what I would say a very landmark statement. And he stands by his words, and he has good, solid data to back up this information. So strategies for prevention, I think you've been hearing me say this all along. Animal-based foods from the diet are really what you will have to seriously consider. And you will have to also consider replacing them with whole plants, fruits, grains, and beans. And I put some grains out for you. I haven't obviously done a big explanation of what plants you can use, but really, if you go to the produce section of the grocery section of the grocery store that you go to, that's where you will find most of the whole plants and the fruits. So a wide selection an ability to share, if you like, between the plants that are green, the plants that are more colored, the plants that are more, if you like, season based. It's really this kind of thing that one has to think of. Fruits, again, I think are some of the most ignored things, unfortunately, by most of us, because they don't tend to replace the, if you like, the titillating tastes that most of us have developed by eating refined sugar things like cookies and cakes, ice creams, and even sweetened yogurts. I mean, these things are full of refined sugar, and refined sugar are like I've often made allude to earlier on in the presentation, that refined sugar has the capacity to injure the blood vessels directly. It doesn't need any other excuse to injure blood vessels, which can directly result in the blood vessel allowing, if you like, unhealthy things like cholesterol to deposit and narrow blood vessels. This is really what it has the capacity to do. So you could, of course, say, well, don't fruits have sugar? For sure they do. But this is the difference between what are called low, and again, I'm sorry to be technical, but there are things called low glycemic index foods, and there are high glycemic index foods. So what high glycemic index foods means is that whatever you eat very rapidly is absorbed in the blood and results in a high blood sugar. Now there starts a vicious cycle where the body releases insulin, because the body has a particular gland called the pancreas, which is responsible for releasing insulin. So there now starts this tussle by the insulin to push the blood sugar that has been increased because of something like a cookie, something like an ice cream, something like white rice, something of that nature. Even other things which are eaten rapidly with very little, if you like, fiber present in them. And fiber is the portion that you're seeing in this. Now, I haven't mentioned so much about fibers, but really the difference between whole foods and, if you like, refined foods or processed foods is largely the absence of fiber. And what's the importance of fiber? Fiber is really the part of the food that helps us absorb, rather I should say, that prevents the over absorption of some of the harmful things that are present inside all foods. And not only that, but it actually smoothens the, if you like, the flow of intestinal material through the intestines. So things like constipation, things like bloating, things like gut illnesses, they're all prevented. Refined versus unrefined sugar. Here you have in front of you a classical example. Candies versus red apples. What does red apples have that candies don't have? Well, red apples, for a start, will have adequate amounts of fiber. They will have virtually no refined sugar. In fact, not virtually, no, they have no refined sugar. What you're seeing in the bottom of the picture is only refined sugar. It's rapidly absorbed. It rapidly gives rise to a high blood sugar. And it also very rapidly, unfortunately, causes this insulin, glucose, if you like, tussle to start. So, and the other big advantage of eating apples would be, as I was alluding to earlier in the talk, something that's eaten slowly will actually not only take longer to, if you like, get into the blood, but also it will allow the sensation of fullness to come early. So that will allow you to not overeat. The other big advantage, of course, is the sugar that you will be absorbing from the apple is very healthy and very beneficial. Because this is something a lot of us misunderstand, that why is sugar healthy from one and not from the other? Well, here you have what's called synthetic sugar, which is very much, if you ever, I mean, I'm sure you've all seen white sugar. If it's really powdered, there is really very little appearance difference between it and cocaine, some of the drugs that cause addiction, etc. Sugar is no different. Cocaine and sugar addiction sadly have the same effects on people. So this again is something I put in here because intermittent fasting is something that is a forgotten sunnah. The Prophet Muhammad, peace be upon him, used to fast, we know from his sunnah, on Mondays and Thursdays and 13, 14, 15th of the month. He also had other fasts, as we know, which used to happen. 6 happened in the month of Shawwal, 9 happened in the month of Zilhijjah if you're not going for Hajj, etc. So there is the opportunity the whole year, and look at just these few advantages. I mean, we're worried about our immunity. We're worried about our, if you like, weight gain. We're worried about our brain health. I haven't even discussed brain health because really this topic is huge, it's massive. But I've just put in front of you some well-known, recognized advantages of intermittent fasting. This is, of course, a secular term. For our, Islamic terminology, recognize that when you fast, you allow the body to go into a resting mode every so often. You actually allow a lot of toxins to leave the body. And in fact, it's a very good exercise all year rather than just confine it to the month of Ramadan. We obviously have religious reasons to fast in Ramadan, but I'm saying, brothers and sisters, if we learn to fast regularly, actually it is beneficial for our body and, needless to say, for our spirit self over the whole year. What's the advantage of physical activities? There you have it. It actually results in stronger muscles and bones. It actually will give you more flexibility, coordination. It will result in a better appetite. It will result in your being able to improve your life all round. You will manage stress much better. You will have increased energy levels. You will actually improve pretty much everything that you want to improve. That's the advantage of physical activities. But stress management, needless to say, my brothers and sisters, is a huge part of this illness. It's a huge part of it. And we are so blessed in being Muslims that Salah is a huge stress buster. It's well recognized. You'll be amazed how much evidence actually has appeared in the literature that prayer itself actually reduces stress in a big way. And again, the ability to have a positivity about what we are doing, right? How do we deal with feelings, for example? How do we practice responding rather than reacting? How do we empathize? How do we create a positive environment and find the things that are going well? I mean, a lot of the time, this is actually something that positively contributes to your heart health without you even knowing about it. I mean, people I've seen, I'm sure you have seen too, people in parts of, rural areas, but also some urbans, people have lived lives into their 90s and they are doing their daily activities as if nothing happened. So this is not a result of some chance. It's not just good food and good environment. It's actually, I believe a lot of it is also managing stress well, managing basically their feelings where they have a bigger understanding to say, you know what, not everything needs to be lost tempers on. So stress busters also, of course, some of these other things, which I mentioned to alluded to already, the positive attitude, the finding friends that accompany, think about it. Most of the time, bad habits, sadly, also take root into a person's life because there are others who encourage them. Again, social media involvement, for example, it has now produced such a huge amount of people that are isolated, that are not just isolated, they're stressed isolated. And of course, this results in, on its own, although the evidence for social media involvement causing heart disease is perhaps not there so much, but the fact of social media causing stress is there in a big way. In fact, there's a number of papers and a number of people who have written on it extensively because of the paucity of time. I won't be able to discuss all of this, but I'm reminding myself and all of you, if you have a big interest in these devices, please recognize that the constant listening, hearing, watching bad news has an effect on your heart. And since there is no hard and fast way of knowing how much does the adrenaline or this stress hormone come out every time you hear a bad piece of news, right? Or you hear of something that you can't do anything about. These things are not small. Time management, again, like I said, the conversation can be very big, but people who don't manage their time well are actually asking for a very stressful life. I thank all of you that this is, like I say, a very long conversation. I'm sorry if I've sounded rushed from time to time. One of the reasons is because I was trying to get all of this stuff. I'd be very happy in the next 10 minutes, 10, 12 minutes to take questions, and I'll try my best, very best, inshallah, to answer them. Inshallah.
So the first question is the question even after lifestyle changes, blood cholesterol is still not controlled. Can we consider cholesterol lowering drugs for short time? Thank you. So this is first question.
I think this is a very relevant question, and it's coming, I think, primarily from the concern that cholesterol being raised in the short term is the reason for heart disease. Perhaps I should correct one thing that may have sounded from me as if I'm supporting that theory that cholesterol is the number one and the only cause of heart disease. The reality is, my brother or sister, whoever is asking this question, cholesterol is like all other factors. Cholesterol does not have a higher ability to cause heart disease if the other factors, such as a person who is not obese. And obesity generally goes by what's called the body mass index or the height waist ratio. And these are things you can easily calculate by checking them out on one of your search engines. You can figure out whether you're obese or not. Number two factor is a person who's physically active, which means you are exercising perhaps 20 minutes a day. And I'm not talking about heavy exercise. I'm talking about something like even being used to going upstairs and downstairs. And I've advised some people, look, if you don't feel like doing anything else, how about making a point to climb up your home stairs 10 times a day? And you can do it in your own spread out way. You don't have to do it in one time. But basically, stressing the heart and increasing muscle activity will be the one thing that would help you exercise. If you can get out for 10 minutes, ideally 20 minutes, because really what the numbers are is 150 minutes in a week. If you can produce walking, if you can do that activity, you will actually undo significant amount effects of your high cholesterol. So high cholesterol by itself not necessarily will cause illness of the heart in everybody, especially people who are not obese, who don't have uncontrolled diabetes, who have no blood pressure, who don't have obesity, and who don't smoke. I hope that's given you an answer, inshallah. But of course, if you feel that you want to lower your cholesterol, I'm not suggesting that you don't. Jazakallah khair.
Jazakallah khairan. So another question, actually, I don't see the name here. It says iPhone to everyone. So I had a heart attack 3 years ago, and I have been on Remifril and
Yeah,
apoclopidogrel pills,
clopidogrel,
and
yeah.
I have had a lot of side effects, and I have stopped taking the pills. Would this affect me?
I think these are questions, Jazakallah khair, the technical questions that are related to medications that you're already taking. Those questions I would direct to your family physician because that's the right person to ask. I would answer this question in a more general terms to say, are you interested in reversing your heart disease? Because noticed in the numbers I showed you, people who've had a heart attack, and I don't know how your heart attack was treated, most of them are treated with angioplasty. And as I showed you, 30% of these stents block within a few months. So that's not a small issue. I did not discuss in any big way the complications of the blood thinning products that are given to people that are not small either. So my suggestion to you would be consider changing your diet. Please consider some of these two resources that I've mentioned. There is also Canada Food Guide, which is actually available on the net. You can also access that. My emphasis to all of you who are attending is to look carefully at the aspect of food, the lack of physical activity, the reduction of weight if you are within that obese capacity, and to stop smoking. And then, of course, stress management. As I say, some stress management techniques are, things people have mentioned yoga. People have mentioned other kinds of relaxation techniques. No problem with that. But I'm saying to put all the emphasis on drugs is what I hope I have taken you away from this afternoon, inshallah. Jazakallah khair.
So our next question is, there's a request. Please tell us the title of the book by Dean Ornish.
So,
This
Jazakallah
month.
khair. So the title of Dean Ornish's book is Reversing Heart Disease.
So another question from Brother Ali Hussein: are breathing exercises good for heart and blood pressure?
Yes, breathing exercises actually are, I alluded to briefly, yoga. Yoga very much has, if you ever had interest in looking up Dr. Onish's book, he actually has a whole section on how to, if you like, learn relaxation techniques. And one of them is deep breathing. So deep breathing, body posture, other things. I'm not necessarily an expert on yoga, so I wouldn't have a lot to add to that. But the short answer to your question is yes, breathing exercises, stress relaxation, other techniques that lower a person's stress, especially in situations where stress is inevitable, would be a perfectly okay thing to do. Jazakallah khair.
Okay, so Jazakallah khair. So one more questions, if you have time, or actually two more
Inshallah.
questions there. So the next question is also, Is nicotine bad for calcium in the body? Uh, then stress and isolationism during the current pandemic COVID-19 are related. And also the question related to broadcasting of this video on Facebook or YouTube, can it be seen again? Um, there a diet to reverse blockage? And also, what if there is better alternative to high C med? Would replacing red meat with chicken and fish be advisable option too? So these are all questions. I'm not sure how many questions we can answer, but Dr. Rashid, I'm leaving up to you. Jazakallah khair.
What I'll do is I'll try and address some of the issues that I can recall because you've made a fairly big. I haven't written them down. The answer to that last question is meat diet itself. And one of the problems with meats, my brothers and sisters, is not necessarily its cholesterol content. The other problem with it is it has been given, and again, if you managed to look up Dr. Grieger, whose book I have put on the slide. He has a website called Nutrition Facts, nutritionfacts.org. Nutrition Facts is one word, .org. If you do get a chance, you can actually look up and he will explain, he has explained in great detail what is being done to meat. So meat has been unfortunately increased in size with hormones. Meat is the biggest source of antibiotics in the human body. And sadly, with the diet of the animals also being very, what I would say, contaminated. And I don't mean contaminated in a sense where something's been added to it in poisonous manner, etc. Not really. But what has happened is the animals have been given an unnatural diet. They are not being fed the diet that they were feeding on. So instead of grass, they are now being given grain. Instead of running around, they are actually being enclosed in a box or in a pen. So these things all add to the animal foods, animal-based foods being not healthy. And so the problem is not just changing red to white. I think you mentioned fish also. The problem with fish, again, there is what's called fish farming going on. You're not getting fish that are actually being caught from the deep sea or being caught in the natural environment. Most of them are actually being bred for purposes of food. And so whenever intensive farming is done for any food purposes, inevitably there's consequences on both the quality and the quantity of the food. So quality is very compromised and quantity is exaggerated. So I hope I've made the point, inshallah. Kaisar, if you can repeat one or two other questions, because I don't remember all of the questions.
Yeah, sure. Jazakallah khair. So there's one question. Stress and isolationism during the current pandemic COVID-19, are these related?
Jazakallah khair. So I think there's no question that when people find themselves out of sync of where they've been, and some kind of techniques have, I mean, in all honesty, nobody could have foreseen COVID coming. In all honesty, I don't think anybody could say isolationism is something we should practice because it's coming. I think we can say confidently that stress would result if we have not learned that there is a bigger purpose behind all of this. And obviously for this talk purposes, I won't be able to go into that detail. But I would just remind us all that the Prophet of God, Muhammad, peace be upon him, he was isolated in that valley for 3 years with all of his family. They had no access to food. They had no access to services. Alhamdulillah, we have access to food. We have access to water. We have access to electricity. We have, alhamdulillah, safe, heated homes. So yes, the answer to your question is, without question, stress is resulting from the isolationist. Not only isolation, but I think the other big problem is the uncertainty that's prevailing. And with the second COVID, if you like, episode still running in the GTA and perhaps other areas, I think there is a lot of uncertainty and unhappiness because of that. Jazakallah khair. I hope that answered your question.
Jazakallah khairan. And two more questions. One is there a diet to reverse blockage?
Without question, this is what I hope I have emphasized in the last 1 hour, that diet is a very big way of not just preventing Actually, it is a way of reversing heart disease also. And when I say heart disease, I mean in particular heart disease that has resulted from narrowing of blood vessels. And the evidence is very big. I mentioned another book that I didn't mention. I think I mentioned it once. It's called the China Study. The China Study. This book also, which was published, I think, in the early 2000s, 2004 or 5, it actually is a study of urban United States compared to rural China. And really the big difference between the incidence of heart disease between the two places, and almost entirely related to diet. The same applies to country of East Africa, as I mentioned, I think Uganda in particular, Kenya also, where heart disease is virtually non-existent. And if you look at the diet that people eat there, you will see without much uncertainty that saturated fat is forming virtually no part of their diets at all. So yes, the answer to your question is very much so. You can reverse and you can prevent. Absolutely.
I So the last question I would say, there's a concept that all people need sugar sweet products to overcome weakness. Um,
I
can you
think
shed
this
the light?
is I think this is more of a myth. Old people's ability to metabolize sugar is not less. It depends on what old people means. Also, in some cultures, 60 is old. In the cultures we live in, people are sometimes really starting their retired life, and they don't feel old at all. So it depends on what this question is implying. But I would say there is no reason for a weakness being treated with sugar. I would say weakness most likely has resulted perhaps from incoordination, lack of physical activity, not doing muscle building exercises. Remember, the joints, the bones, the muscles, they all have to coordinate for us to function on a daily basis. These are called the quality of life activities. So quality of life activities is really what most of us look at. Quality of life activities usually means that you are able to go from A to B without assistance. Quality of life means that you are able to express yourself, right? Cognitive decline, etc., which occurs a lot of the time because, and by cognitive decline, I mean memory problems, inappropriate response problems, sometimes, not just forgetfulness, but also inability of insight, which means you just cannot understand things. These are not automatic things of getting old either. And inshallah, in another webinar, another day, I will address the issue of how you can undo the so-called Alzheimer's disease, or at least prevent a large part of it, so that we don't accept this automatic about getting old means that you get sick and unwell. I hope that answers the question, inshallah. And I hope, inshallah, this little bit of information that I've shared with you today, inshallah, is benefit to you. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.